Should we be worried about the burden for state and federal government with all these additional people who are supposed to be covered now?
We should be worried about the burdens on federal government, on state government, and on you and me for paying for all of this care that's going to be out there, and the weights that we're going to have to face. The federal government, the question about whether they deal with these things and implement the policies with fidelity. They haven't implemented a policy with fidelity in the past. Why would we expect that they're going to do that in the future? The Medicaid population is going to soar in North Carolina, and we're going to be adding people on to it who already are eligible. So these people aren't going to be at that 100% federal match. These are going to burden the state budget. And in both cases, and with Medicaid, with Medicare, the way that they're laid out in the health care reform, it is going to reduce the payments to doctors. It's going to lead to worse care for them. And so when you talk about access, what we should not be looking at for improved access is Medicaid to take on more people. That actually leads to worse access to care than when people are uninsured. That's why people don't take Medicaid right now. And then the burdens on you and me and everybody else who has insurance and purchases care right now, as these people on Medicaid use the emergency rooms more, that's where the greatest use of emergency rooms comes. That's going to increase the cost for all of us. And then it's going to make it more difficult to see doctors, and it's going to increase the price across the board in addition to the rules on insurance that we're going to have to face.